Welcome back to Sunrise. Uganda has closed its border with the Congo as the World Health Organization reports suspected cases of Ebola have surpassed 1,000.
The outbreak is spreading rapidly, and some experts are worried that the world's response is not keeping up. To help us put the outbreak and the virus response in context, we're checking in with a public health expert. Dr. Omer Awan is with the University of Maryland School of Medicine and joins us live. Thank you so much for being with us this morning.
My pleasure. Thanks for having me.
So we know that the number of deaths has increased rather dramatically in less than 2 weeks. What is the status of the outbreak and how do you see it?
Well, Hillary, this is a serious disease, Ebola, and it can spread from people to people. And the current species of virus that's responsible for the outbreak that we're seeing in the Democratic Republic of Congo is known as the Bundi-Bujo species of the Ebola virus. And this is a concerning species because there are no effective therapies that can help improve symptoms. It's also problematic because there are no approved vaccines that can help mitigate the spread of this disease. And as you can see, it's been very difficult to contain for a number of reasons. Also, this is an area where there's a lot of political turmoil, military conflict, and instability, and that can be problematic for helping contain the virus. And that's why we've seen now more than 200 suspected deaths already and nearly 1,000 suspected cases already. So something to watch going forward.
So obviously a lot of folks here at home wondering, is this something that could ultimately endanger Americans? The administration, Trump administration that is, continues to say the risk to Americans is low. They have put in additional screening in place at international airports. But is there a chance that this could ultimately come to America's shores?
Well, I would agree that the risk to the general American public is very low. We've had no cases here confirmed in the United States, but low doesn't mean zero. And of course, there's always a possibility that there could be cases in the United States. Infectious diseases don't respect international borders. So, definitely with the ease of travel, it's certainly possible for cases to occur here, but, the risk is very low. Those most at risk are those that are actually in the area where the outbreak exists. So the Democratic Republic of Congo, Uganda, and neighboring countries like South Sudan. Remember, this is a virus that spreads through direct contact with infected bodily fluids, things like saliva, sweat, blood, and vomit. So my sense is that we probably wouldn't see many cases here in America, if any at all, and the threat is very low here in the United States.
But everything is just a plane ride away, right? The U.S. did impose a travel ban, the first ever issued specifically in response to an Ebola outbreak. So people are supposed to be barred from countries where it has been coming, like the DRC, Uganda, South Sudan. Some exceptions made for U.S. citizens. And we're interviewing someone later who just got back from Uganda and they weren't screened at all. So I'm wondering if you find that problematic or fits with the restrictions.
Well, definitely it's problematic that they weren't screened. That's of serious concern. But what I will say, Hillary, is that travel bans have not been shown to be effective in terms of a public health measure to help contain a virus or an outbreak. What is effective is isolation, quarantining, international contact tracing, testing. These are the measures that can really help contain an outbreak. Now, with that said, I believe that the United States is definitely much more prepared today than we were, for example, than the 2014 outbreak. We have rapid laboratory diagnostic testing. We have specialized containment units, biocontainment units here in the United States to help specifically to treat people with Ebola, to contain and isolate people with Ebola. And we have surveillance systems, as you said, at airports with screening, one of which is Dulles Airport, nearby at Sterling, Virginia. So definitely we are more prepared, but that doesn't mean that we're not vulnerable. We have, weakened our global health infrastructure in terms of what we've invested in globally. An example of this is the USAID funding. Now we have decreased funding by hundreds of millions of dollars, and this traditionally has been used for developing surveillance systems abroad. Deploying diagnostic tests for detecting the disease, and even training epidemiologists to go to these countries to help contain outbreaks. That doesn't exist anymore. So when that funding has decreased, that certainly makes us much more vulnerable to threats like Ebola going forward.
Correct to assume that because there is no vaccine for this strain of Ebola, that doctors don't know a lot about it, and that translates to not necessarily knowing how best to treat it?
It doesn't mean that we don't know much about it. We certainly know a lot about the Bundy-Bujo species of Ebola virus, but yes, we don't have a vaccine, and that can cripple our response because we can't help contain the virus, or we can potentially mitigate or decrease the mitigation of the spread of the virus. But now the treatment is containment. That's the difference here in this particular scenario. Treatment is containment. Treatment is identifying cases early, testing for cases early, containing diseases, doing international contact tracing, identifying people who may have been exposed. This is how we're going to win and the battle of preventing the spread of this disease.
Is the U.S. Going to really step up and do what it once did before the USAID cuts, or is that just not possible?
It's certainly possible. USAID was a critical piece to the puzzle in terms of helping contain viruses. U.S. has now withdrawn from the World Health Organization, which certainly limits our authority on the global health stage. We've decreased USAID funds by hundreds of millions of dollars. This is not just a small thing. We have decreased significant funding that has helped us respond to a lot of these global health threats previously. So, yes, I am deeply concerned that our public health infrastructure has weakened significantly. We've also, not just with global health, but we have, you know, with the CDC in particular, we have laid off hundreds of critical workers that respond in outbreaks just like this in Ebola. Now, with that said, we have sent workers to Ebola. We have sent CDC workers to different airports to help with screening and containment, but it doesn't look good when we've withdrawn so many critical healthcare workers in a situation that's very dire, like the Ebola outbreak that continues to spread with nearly almost 1,000 cases already.
Doctor, is there one parting message? Look, I get, the threat to Americans is low, but what should Americans know as we watch this tragedy sort of unfold in Africa?
Well, we should continue to monitor health alerts, making sure that we understand what Ebola is, what your risk is, understanding and learning from credible health sources. Of course, the risk is absolutely low here. It doesn't mean that it's zero, but it is low. The important thing to remember here is that, you know, testing is very important, particularly early testing. If you're a healthcare worker, make sure you wear PPE, personal protective equipment, things like gloves, gowns, masks, goggles. These are the things that are going to really help prevent the spread of the disease going forward. But this is not a reason to panic. It's just a reason for us to be informed and to be educated about what's going on, abroad and potentially how it could affect us here in the United States.
All righty, Dr. Omer Awan from the University of Maryland School of Medicine. Thank you so much for being with us. We really appreciate it.
My pleasure. Thanks for having me.